Medical workers of Reddit, what were the most haunting last words you've heard from a patient? My uncle was born with Down syndrome. He was 42 when he died but had the mind of a 3-ish-year-old. He could do things like brush his teeth, dress himself, etc. but needed prompting and supervision. My GMA, his mother, died in 1974. My uncle died in 1984. The night before he died he told all of us that Mama came to see me last night. My dad asked him if he had a dream about Mama. He said, no. She sat on my bed with me and told me she was coming to get me soon and take me home with her and not to be scared because it was all okay. We dismissed it. 24 hours later he was dead. He died peacefully in his sleep. Thanks for the award. I'm new so I don't know what it means yet but
I was about 5 or 6 when my grandfather was on his deathbed. The last thing he did was put his hand on my shoulder and said, "No wonder you never liked my spicy food," and then he passed about 10 seconds later. We were all super confused. About 3 months later I almost died from suffocation after eating some salsa. At the hospital I was diagnosed with a capsaicin allergy, spicy food. To this day it still creeps me out. No one knew I was allergic before then, and I didn't show any signs either. It wasn't words, but the most haunting death was a patient who was DNR, through her and her family's wishes. She was losing her battle, and her family wasn't there. She was getting frantic and looking around and half sitting up in bed, and a nurse with more experience than me took her hand and calmly said, "It's okay. You're not alone. We're right here with you, it's okay to leave." The patient immediately calmed, put her head back on the pillow and died. I knew I wanted to be that nurse when I grew up. How the hell did she know just what to do and say? I've never forgotten it. Nurse. In hospital caring for 40-ish man with brain tumor, coming in and out of consciousness. Not to be resuscitated. His 16-year-old daughter was crying non-stop for 12 hours. His wife, who had been given a few months to prepare herself, was calm and focused on her husband. I had to routinely check his level of consciousness, which involved talking to him in a loud voice, responds to auditory stimulation, which I did not like to do. So I asked his wife to do the loud voice part, so the voice he would hear would be hers not mine, and she did so without hesitation. The only response we observed with her vocalization was that this by now profoundly unconscious patient took her hand to his lips and kissed it. He stopped breathing very soon after that. I am haunted, but not in a bad way. Paramedic here. I was transporting a cardiac patient, and while we were both watching my EKG monitor, he went into VFIB, a lethal heart rhythm. His heart stopped pumping blood effectively at that point, but there was enough blood pressure for a few seconds of consciousness. He looked at me and said, "But I don't see the light," and went unconscious. Coded him, shocked him a few times, meds by the handful, but he died. Not a medical worker, but my friend's husband was dying from cancer. He'd done lots of chemo and one surgery, and overall his prognoses looked really good. He'd gone through another surgery, and he was due to be released from the hospital a couple days after this story takes place. My friend had been with him and was going back home to sleep for the night. Just before she left his room, he said, "I'm going to miss you, my love," and obviously she thinks nothing of it, saying, "I'll miss you too. I'll be back in the morning." Couple hours later he was gone.
I'm a medical worker, but this is just a personal story about when my dad passed. He had pancreatic cancer and had a mild seizure the night before. The doctor came in to assess him and asked him a few questions. He couldn't remember what year it was, his name, nothing. The doctor turned and pointed at me and said, "Who's that?" My dad confidently replied, "That's my baby girl, a girl has no _username." He went silent after that, coded a bit later, and died the next day. He couldn't remember anything but that I was his daughter, and those were his last words. Nursing home. Most elderly people are at ease as they get nearer and nearer to death. But this old lady, as she deteriorated over her last week or so, would scream, "I don't want to die. I don't want to die. I don't want to die. I don't want to die." Really heartbreaking to see. Not a medical worker, but I knew a guy from middle school who had a degenerative disease and he knew he'd die young. It was New Year's Eve and he'd just gotten out of the hospital for the third time in a few months, so we were partying at his apartment. Somehow I ended up being the last person there with him and his girlfriend, and we were pretty drunk and got to talking for a while about how great the party was, how much nice it was to have friends like ours, plans for the future. All of a sudden he said, "God, I wish I had more time." I always thought I'd have more time, not his last words but they're the ones that stuck with me. We weren't close by any stretch but I always wished he had more time too. He was so friendly and kind, the type of person who made you feel like their closest friend even if you were a total stranger. He was a good man and he deserved a longer life. RN here. We had a patient on our unit for a year almost. He was so mean, thought we were always hurting him when we tried caring for him, every interaction was very unpleasant. Well, I just had a bad break-up and was the world is ending, depressed. The day he died he was calm and asked me if I was married. Which street the time made me kind of sad. So I just answered, "No I'm not." And he just said, "You'll find someone, and I know you aren't trying to hurt me." It was so concise, to the point, and memorable for me. Honestly it was me sweetest thing he could have said to me and given the scenario I would say it was the sweetest thing anyone has said. On his deathbed, no formalities, just telling me what he had always wanted to talk to me about. I cried when I left his room and he passed away right at 7 p.m. when my shift ended. So I got to be with him. Not my patient but a friend of mine. He had a patient with a AAA abdominal aortic aneurysm. Your aorta is bulging and throbbing about ready to pop. The pain is very severe and agonizing and if it does rupture the pain immediately goes away and feels so good but your chances of survival are pretty much non-existent even if you are prepped on the operating table when it ruptures. Anyways he had a 15-year-old with one and on the way to the hospital she looks at him and just says, "Oh that feels so much better," and died about 10 seconds later. I'm not a medical worker but on February 28 of this year we had a bad ice storm in Oklahoma. I had no choice but to go into work and I worked 45 miles from home. The roads were awful and a solid sheet of ice. I witnessed a car accident. A double tractor-trailer semi versus a Ford Focus. I had to stop because of it and I slid to her immediately. My dad is a retired firefighter, EMT and my mom is a nurse so I wanted to try to help if I could. When I got to her she was hanging out of the driver's side window and the back of her head on one side was missing. When I went to feel for a pulse on her wrist, she grabbed me, even though she was unconscious. She was gurgling and wheezing. I stayed and held her as she died. I listened to the gurgling and begged her to open her eyes and she wasn't alone. That was the worst thing I heard. Her gurgling and death rattling. Not a healthcare worker but my grandfather passed this week at 89 years old. He was a very sharp sane man, not senile or any dementia. The 2 days leading to his passing he began to see things. He told me, "Do you see Michelangelo painting?" I said no. He said, "He's painting invisible dust. Everything he paints disappears. I hope the bathroom is still there." He also told us he could see little men jumping from the fan blades. It was really strange. It sounded like he was tripping acid but obviously he wasn't. He prayed over and over the night before he passed. We found him deceased in the morning. Not in the medical field, but when my grandmother was in the hospital with kidney failure and dementia, I went to visit about a week before she passed. After we heard the news and flew out, the nurse informed us of an exchange they had the night of, "How are you doing, Mary Lee? Is there anything you want to do tomorrow?" "Oh, no, I believe I'm going to go see my mama tonight." She died a few hours later. EMT on a call where one 6-year-old girl and her mom were in a serious MBA. Mom was hanging on but daughter was in bad shape, crushed chest, head cracked on pre-airbag days. First responders were trying to open wreckage to get access to patients. I was talking to the girl to try to keep her calm. She's moaning from pain, can't see her mom due to blood caked over her eyes. She suddenly stopped moaning and said quite loud, "Mom. It doesn't hurt anymore." Her mom lost consciousness at this point and didn't respond. Daughter turned her head slightly toward me and barely opened one eye just enough to make eye contact with me and whispered, "Please tell my mom it doesn't hurt anymore." She was pronounced by an MD that showed up 3 minutes later. My buddy who went on to be a doctor had an elderly female patient. Probably 90 to 100 years old. Her daughter left the room to get coffee and my buddy had to check on her vitals. They were normal. Then she woke up, smiled and got teary-eyed. She said, "I knew you'd come back for me. I am sorry I didn't marry you. My family wouldn't let me. But I will now, I promise." My buddy just held her hand and smiled. She laid back and closed her eyes and her heart stopped. She had a DNR and was gone just like that. Her daughter had no clue what she meant. Her husband had been dead for 10 years and they were married since they were 20. My buddy doesn't know if it's relevant, but we are black and maybe she was in love with a black guy a long time ago. Because she was looking right at him when she spoke. IDK, shit's weird. When I was a senior resident, a young man, late 20s, was admitted for pneumonia. He got worse quickly and I was called to his room to help while on call that night. He was having trouble breathing and needed intubated. I explained all this to him and that I would sedate him and then get him intubated so we could help him breathe. He agreed and we got everything ready. The last thing he said to me was, "Doc, please don't let me die." I told him I would do my very best. I got him intubated and transferred to the ICU. A few weeks later I was on call covering the ICU and he was barely hanging on. I knew he would not make it through the night. He went into V-fib several times and I was able to bring him back, but only briefly. He was just too sick and he died shortly after that. It was horrible talking to his mother and girlfriend and comforting them knowing the last words he ever spoke were to me saying, "Please don't let me die." Thank you for watching. If you enjoyed this video, please hit that like button and subscribe to the channel. We upload videos almost daily.